In SCOAP, we monitor the temperature of patients at the end of an operation. When patients have the correct temperature, we call it normothermia. If they're too cold at the end of an operation, it's called hypothermia. The goal is to maintain normothermia, and in SCOAP we measure that at the end of an operation, usually by temperatures that are monitored by the anesthesiologist. The science behind this measure is that when patients are cold, they have a 2 to 3-fold increased risk of a surgical site infection. Surgical site infection has obvious impacts on the patient, but also increases the cost of care and the burden to the hospital. When looking at a SCOAP report, if the percentage of the time that the patient is normothermic is less than average or less than benchmark, it's an opportunity for you and your hospital to work on maintaining normothermia. The actions that can be included may be increasing the temperature of the operating room, the better and broader use of forced air warm blankets or bear huggers, and other interventions including warming intravenous fluids. All those options are possibilities and actions in response to a SCOAP report. When talking to surgeons about hypothermia or normothermia, it's important that they recognize their role in keeping the patient warm. It's also important that they understand whether or not all those other metrics are being followed, like the use of forced warm air or the temperature of the rooms. When speaking with administrators, this is one of those areas where SCOAP metrics that focus on preventing surgical site infection decrease the costs of care and improve the efficiency of the hospital.